Okay. Good morning. My name is Nancy Kelleher, and I'm the State Director for AARP. With me today is Nelson Megna, our State President, and many other members of AARP. Last week, we saw our congressional delegation sworn into office. And next week, we see our President take the oath of office. This week, we celebrate the fact that our state legislative leaders are working together to urge Congress and the new President to work together as well for economic and health care security for all Americans. The time for gridlock and partisan battles is past. The time for action on both health care and economic security is right now. That's why we joined 49 other states today as AARP, SEIU, NFIB, and the Business Roundtable, the national sponsors of Divided We Fail, as we present over 1 million Divided We Fail pledges to Congress as they start their new session. Here in Maine and across the nation, our combined memberships say it's time to end the gridlock, the despair, and the quiet desperation for all citizens who worry that they are only a paycheck away from financial disaster and only a heartbeat away from a medical condition that may bankrupt them and their families. We must work together to bring the hope and the reality of access to health care and economic security for all Americans. Because if we don't, and we're divided, we will fail. I would like now to introduce David Clow from the National Federation of Independent Businesses.
Thank you. I'm here today representing the National Federation of Independent Business and the thousands of small business owners here in Maine, in a sense giving a big voice to the little guy and woman who own small businesses throughout our community here in the state. For 20 years, the high cost of health insurance has been the top concern of small business owners. And I have to say that the situation has gotten worse over those 20 years, and in Maine is particularly acute. NFIB believes that we must find a way to fundamentally alter the forces driving the costs, and over a year ago it joined Divided We Fail in an effort to come together with other organizations that we don't normally work with, because together we have to find a solution, not separately. NFIB also believes that the time is more urgent than ever to find a solution to the problems. We want policymakers to break the gridlock, and we want to explore common sense, practical ways to bring down the costs or manage the costs and expand access to affordable health care for small business owners, their employees, and Americans. We believe that the coalition will spur national leaders to address this issue, and we call upon them to do so at the earliest opportunity this year, both the Congress and President-elect Obama and his administration. Lastly, I would just say that the issue is especially important to small business owners because they are the nation's job creators, and their ability to provide jobs and maintain workers and treat them well depends on the ability to manage the health care costs. Right now, increasing number of small business owners are finding it impossible to do so, either by dropping coverage or not picking it up to begin with, which affects adversely their employees and affects our community and the state. That is all I have to say this morning. Now I'd like to introduce Bruce Hodgson, representing the Service Employees International Union. Bruce.
Thank you, David. Well, good morning. I'm Bruce Hodgson, President of the Maine State Employees Association, SEIU Local 1989. You know, these are unusual times when members of such diverse groups as the National Federation of Independent Businesses, the AARP, and a union, labor union, all join together with legislators from both sides of the aisle for a common purpose, I got to say, it must be history to have a labor union leader be introduced by someone who's the head of the small business group. But it does also tell us just how important and what an unusual time this is and how important this all is. We all understand that the challenges facing Maine people and our fellow Americans are enormous. The recession that plagues our economy continues to deepen, and we saw 2.6 million American jobs lost last year. Healthcare costs keep spiraling upward, leaving over 48 million Americans uninsured. Financial insecurity is putting the livelihoods of millions of hard-working Americans at risk, as well as endangering their hard-earned retirements. Everybody here today understands that the only way America is going to solve these problems is by putting our differences aside and working together. Today, members of MSCA SEIU join with the AARP, the NFIB, in calling our nation's leaders to make health care and financial security for all American workers their priority. These all seem like impossible tasks, but I'd ask you to consider what our next speaker has accomplished. In 1996, she became the first woman in Maine history to serve as Speaker of the House of Representatives. And just last month, she was elected President of the Maine Senate, thus becoming the first woman in our nation's history to serve in both capacities. But I'm also willing to bet you that Senator Mitchell wouldn't tell you that these were her greatest accomplishments. Instead, she would talk to you about how she's been a relentless advocate for all Maine people, for those who want to achieve the American dream, for those who want to graduate from college, and for those who dream of buying a home here in Maine. Senator Mitchell is an inspiration to all of us that work to make Maine a better place to work. So please join me in welcoming Maine Senate President Libby Mitchell.
Thank you very much. I must say that's one of the nicest introductions I've ever had, and I'm very grateful. But I'm here to tell you we're not divided. You have to look at my Republican Senate leader. We're here together. We're not divided. We're not divided by age. I'm the only leader here who's old enough to be in AARP. But take a look at the Speaker of the House. She represents the next generation. But we're not divided, and we will not fail. We cannot afford to fail. The time for talk is over. You often wonder why people who are making speeches use examples from real life. I'm going to tell one quick story because this woman says it all. Basically, she underscores my belief that you can't afford to waste a crisis. And it is this crisis that brings us all together to focus on what is right. I have a friend who is a waitress in Augusta. She is not a policy wonk. She couldn't begin to tell you. She's not even old enough for AARP. She's not a small business owner, but she's a mom and a waitress and gets up and works every day of her life and worries about health care for herself and for her children. Her solution was simple. Tell Congress, because it's big enough for the whole country, the poor state of Maine is doing the best it can, tell Congress to make everybody pay a little bit for their fair share and give everybody access to the right kind of health care. Preventive, making sure our children have their inoculations, making sure that we don't have to go to a hospital because we're getting the right kind of health care. She's got it. How hard is it for our elected leaders in Washington to get it? And thank goodness we are united with a group like this. It is my privilege now to introduce to you the next powerhouse. There is no one that I've enjoyed working with more than the Speaker of the Maine House of Representatives. I'm old enough to have worked with her mom, but I'm going to tell you something. She knows more and does as much. She is fabulous, and no one would ever suggest that she came to office riding somebody's coattails. She came on her own. She is a leader that you're going to hear a lot more from for the rest of the days beyond health care, and frankly, I always turn to her for advice on health because she was a member of Appropriations, she was a member of Health and Human Services. She gets it, and she's helping us all. Welcome, please, Hannah Pingree, the Speaker of the House.